The oldest treatises on yoga, from that we now draw information on body practices, extend back hundreds of years. Sciences that study the man, anatomy, physiology, biomechanics, kinesiology, have leapfrogged in their development. In ignoring their knowledge, one contravenes the idea of advance that underlines the practice of yoga. The yogi of today should practice in the vein of intelligence. That is why our course of video lectures shall be dedicated to analyzing the nuances of Hatha Yoga anatomy and physiology. My name is Natalia Kravets. I am the Ukrainian Federation of Yoga instructor, yoga therapist of the Ukrainian Institute of Yoga and Yoga Therapy. The topic of our today's lecture is the neck warm-up. Do we need warm-up in yoga? We definitely do. Warming up exercises get the body prepared for further practice, ensure joints and muscle security in the course of complex asana performance. In the process of warm-up, the blood flow towards muscles enhances. They become softer, or, as we call this, warm, prepared for the practice that follows. Muscular compartments, or fascia, become more elastic. So do the tendons and ligaments, thus ensuring correct setting of joints in the course of asanas performance. Besides, the warm-up in itself constitutes the practice of yoga. In the course of doing it, one can become aware of one's habitual posture and change it. While warming up, one can better sense the direction that different muscles move in, so that later, while performing the asana, one can bring them together into a long muscular meridian. The most common variant of incorrect position of the neck is the head protruded forward, with the rib cage shifted. The shoulder joints here as if move towards each other, and the shoulders are raised. As a result, the neck shall visually shorten. Such position of the neck can be accompanied by reduction of venous blood outflow from the head, at least in vertebral veins. If we proceed with practicing yoga without compensating such position of the neck, it shall result in aggravation of the symptoms that this posture entails. In particular, then can be headaches, memory impairment, degradation of attention. That is why the first thing we should do, even before starting the warm-up, is compensate the incorrect neck position. For this purpose, step 1, we open the shoulders. Step 2, we drive down the blade bones and shoulders. Step 3, shift the chin slightly backwards. The position of the neck depends upon the position of the thoracic spine. The forward head posture that we have just corrected particularly results from stooped chest and raised shoulders. In most cases, this position comes from tight upper part of the trapezius muscle. Therefore, in order to set the neck correctly, let us learn more about this muscle and work with it. The trapezius muscle starts from the back of the head, then continues along the cervical vertebra and almost all the thoracic vertebrae. Its bundles come to the blade bone and go a bit further to the clavicle. The upper and the lower part of the trapezius muscle are opposite in their functions. If the lower part contracts, the blade bones come down, whereupon the shoulder shall visually also drop. In case of the trapezius muscle upper part contraction, the blade bones shall go up, and the shoulder shall by eye rise as well, with the neck getting shorter. This is actually the habitual inharmonious posture that we usually have. That is why we shall start with moving the shoulder blade up and down, thus making the neck prepared for the further work. This is the most superficial muscle of the neck back, the trapezoid. We move the blades up and down. We can now make this move more complicated by raising arms with elbows straightened and palms stretched out. We raise the shoulders up and bring them down. In fact, it is the blade bone that we move up and down. Now leave the shoulders down, release the arms. Try to memorize this posture. We can also remember the way we were compensating the forward position of the head by pulling the back of the head slightly backwards. Our neck is now ready to continue working. Prior to every new move, be sure to check vertical position of the neck. For this purpose, open up the chest, pull the back of the head backwards, and axial extension. That is, we continuously pull our temples up. This is the key, the basic principle of the working with the neck. Whatever you do, retain the axial extension of the neck. If you do the neck warm-up in the standing position, be sure to feel your feet. Shift from one foot to the another. Shift your weight to the toes and heels. Slightly pull the soles up. On the one hand, we need this to enliven the muscles, and on the other hand, to focus on sensations coming from this zone. Unbend the knees, thus bringing together, that is, contracting the anterior part of the thigh, the quadriceps muscle. The task of straightening the hip joint secures contraction of the gluteal muscles. Once again, we set up the upper body and open the chest. Proceeding to work with the neck, remember to keep the bottom gathered. The information that comes from the knee, feet and hip joints receptors is in the framework of the nervous system, added to the data received from receptors of the neck muscles, in particular the lateral scalene muscles and the shorter suboccipital ones, and from the muscles that move the eyeball. The whole of this information comes to the vestibular system to report our stable position. During the warm-up, in order to prevent dizziness, we need our lower part to be properly set. The feet, the knees, active thighs, and active buttocks. And now we can start working with the neck. The next stage is side flexions. We tilt the head towards the shoulder, retaining the axial extension. Therefore, the nuance of this move is not so much the tilt as stretching upwards. To one shoulder, to the another one. Let us consider eventual incorrect variants of this motion performance. In the course of tilting, the head may uncontrollably move back to its habitual position so that the chest stoops and the neck shifts forward. As a result, side motions in this position shall not properly involve the back of the head. The blood flow from the head shall remain unchanged, and we remember that in this posture it is already unpaired. Another incorrect version is represented by the situation when tilting the head to one side entails opposite shoulder rise. Once again, it involves uncontrollable contraction of the trapezoid upper part. Therefore, let us make small adjustments. The shoulders can be fixed with the help of the palms by putting the fingers in them. We shift the back of the head slightly backwards, pull the temples up, and keep our eyes looking straight ahead. The lateral neck wall contains the so-called scalene muscles. From the transverse processes of the upper cervical vertebrae, they go down behind the clavicle to the first and second ribs. When these muscles contract on one side, they bend our head. In case of the head forward position, these muscles remain continuously shortened. There is the risk that they may squeeze between them the nerves placed there. In the phrenic nerve that from the neck goes down to the phrenic diaphragm and controls its work. As a result, the least thing that may happen is respiration disturbance. These are also the nerves that come out of the cervical segment and go down to the arm, managing its operation. This is also the vagus nerve that proceeds down to the abdominal cavity and secures performance of the internal organs. To this end, this small scalene, if constantly shortened, may cause impairments in the entire body. That is why lateral flexion is very important to us. And don't forget about extension. Our next motion shall be head turn to the side. And once again, initial correction. Draw the shoulders down. If you have troubles in feeling them raised, you can stabilize them with the help of the palms. Push the back of the head slightly backwards, pull the temples up. Retain in this position. Turn your head to the right. And then to the left. Here, beware that the head does not move forth. Otherwise, it shall result in incorrect posture involving the head forward position and excessive curvature of the cervical spine. Lateral head turns shall be coordinated with eyes turn. One of our nervous system reflexes implies that the head is ready to turn to the same direction that the eyes do. This is probably preconditioned by our animal nature, the ancient times when we were chasing the prey running on all fours. The glance turns and we are ready to run after the prey. We can use this reflex to facilitate the move. First we turn the eyes and then the head follows. Now the same to the other side. This very principle is used in the range and performance of the asanas. Using this reflex, we can also make our task more complicated. Let us control or even separate the head and the eyes movements. The glance goes to the one side, the head turns to the other side. Make sure you don't shift your head forward. For this purpose, push the back of the head slightly backwards. Then we again return to the standard variant. The eyes stop, head turn, the eyes go to the other side, stop, and then the head turns. We separate these two movements. Try to control the head turn so that it makes no moves without our respective command. Then we bring the glance back to the center and return the head to the central position. Let us now proceed to analyze the anterior wall of the neck and study the muscles that are located here. The muscles of the anterior wall are mainly of flexing character, that is, they bend the head forward. The most significant muscle that we see on the anterior wall is the sternocleidomastoid. It is named so after the points of its attachment. Please note that we have omitted the most superficial muscle that is called the platysma. It covers the neck just like a soft veil does. We now focus on the sternocleidomastoid, that in terms of its functions is also referred to as the head nodding muscles. When the muscle contracts by shortening, that is, the points of its attachment move closer to each other, and both muscles, the right and the left, work together, the head tilts down. There are two variants possible depending upon condition of the deep muscles. First, the head flexes along the anterior wall and the chin comes down to the chest so that the muscle shall shorten. Another variant, in the event when we have higher tone of the back muscles, the spine extensors, the head shall move forward. That is, the points of the sternocleidomastoid attachment shall once again draw closer to each other, but there shall be no chin line on the chest, while the head shall be as if standing on two pillars, the shortened sternocleidomastoid. That is why it is essential that while warming up the neck, we work with each of the said muscles separately. In the process of the head turn, the muscles work in different directions, the right and the left one. When the muscle shortens, that is, the points of its attachment move closer to each other, the head turns to the opposite side. We see that the muscle becomes shorter and thicker. Moreover, it goes along the neck frontal wall as a vertical roller. When the muscle extends, that is, the points of its attachment move away from each other, the head turns to the opposite side. The muscle on the other side shall perform vice versa. Thus, when the head is turned to the right sternocleidomastoid shall be extended, while the left sternocleidomastoid shall be shortened. When we turn the head to the left, we shorten the right sternocleidomastoid and extend the left one. In this case, the muscles shall come as antagonists performing opposite functions. The sternocleidomastoids often appear shortened, that is, the facial compartments that they are located in shall be helping the muscles to keep the head in its forward position. The muscles thus becomes tight. Prior to doing our neck warm-up or following it, we can massage this muscle. Find the point of its attachment in the lower part and rub this zone down. Grope to the point of this muscle attachment behind the ears and massage it. We can also warm the entire muscle by pinching it slightly along its surface. Now, let us try to shorten and extend this muscle. Keep your shoulders still. You can fix them with the help of our palms. In the course of the head turn, one muscle has come into vertical position, a nice muscular band. If we now pull the ear downwards, the muscle shall shorten. If we pull the ear upwards, the muscle shall extend. And we can now do a kind of warm-up for the right sternocleidomastoid. In order to enhance the extension, fix the lower point of its attachment with your fingers. Now, pulling the ear up shall entail a more active extension to the facial compartment, in that the muscle is placed, securing the freedom of its muscular movement. Bring the head back. Close your eyes for a couple of seconds. Introspect the feelings you have now. What is the difference between the right and the left halves of the neck? Probably there is a feeling of slight muscular disbalance, left, as if the head has remained turned to one side. This is because one muscle has done some work while the other one hasn't. But note that if you have your computer standing on one certain side, so that your head is usually turned there, you might have one of your sternocleidomastoids habitually shortened. That is why, in the course of your warm-up, you should probably pay more attention to this very muscle. Now we can work with our left sternocleidomastoid. We can refer to the head down tilt as the flexion and the up tilt as the extension of the neck. Moreover, each of the said motions, flexion and extension, can be divided into two parts, upper and lower. This is caused by the difference in the cervical vertebrae structure. The most mobile part of the neck is the segment between the first and the second cervical vertebra, where the anatomy of these two structures ensures circular rotation of the head. The lower part of the neck is less mobile. But it happens so that because of our inharmonious postures, a part of the movement gets lost. In this regard, we usually lose upper flexion when we press the chin down, so that the head simply falls forward. but we can break every position into upper and lower one. Upper flexion and lower flexion. When having our chin pressed in, we tilt the head up and grow forward by the crown. The same refers to the back wall. We can single out lower extension when we press the chin, tilt the head up, and the rest of the neck against the upper thoracic vertebra, almost lying down the back of the occiput. The position that very much resembles the one they have in the Venus waltz. An upper extension when from this position we raise the chin. To sum this up, lower flexion, lower extension, chin pressed in, upper extension, upper flexion, lower flexion, upper extension, and we try to rest upon some lower points, and only at the stopping point we raise the chin. Mind the way these movements are done habitually without corrective action, when the whole of the head is moved forward and dropped down, with the seventh cervical vertebra protruded. Yet, when going back, it bends sharply in the zone under the back of the head. In this way we omit two positions that I refer to as aristocratic: the aristocratic nod and the aristocratic stretch of the head back, the way they do in ballroom dancing. And one more exercise for the neck. But now we shall be moving the chest, keeping our head still. That is, in all previous variants we had the lower points of the muscles attachment fixed, the only upper points moving. Now we do vice versa. The head is fixed, the neck is stabilized on deep muscles, while the superficial muscles work in turn, pushing the shoulders alternatively, back and forth. The head should stay at rest, shoulders down, the back of the head is shifted backwards and the buttocks are set together and toned. This occurs standing on the floor. This is also the alternative fraction of the sternocleidomastoid muscles and trapezoid, but the sequence of contractions shall happen in somewhat different mode. Please note, it is this mode that the muscles contract and coordinate between each other while walking. This is also important. Our final movement shall be the head rotation. The rotation of the head can be done in two variants. With your hands fixing the basic neck length, try to rotate the skull above the upper edge of the palms. Try to keep the rest of the neck as still as possible. In this case, the upper parts of the cervical spine shall move better. The short muscles laid onto the back of the head shall be a bit more active. Now put the arms down and make a long move. That is, we subject the head to all possible bending and tilting moves. Lateral tilt with actualization of the tension line, smooth transition to tilting up. This is our upper extension. It is essential that you feel the zone that is open and extend to the maximum. The other side bending. Move the head forward, trying to have your chin stabilized. And for the crown, we grow up and up. Proceed to draw a circle with your crown, each and every moment remaining aware of which of the neck zones is now extended and which one is shortened. The warm-up of the neck can be done not only in standing position, like we've been doing today. It can and should be done in different positions. When doing the standing workout, we were highlighting the work of the feet, thighs, knees, buttocks. That is, we were coordinating the performance of the head with that of the lower limbs. In the course of the neck warm-up, done in the sitting position, we need to better conform the performance of the neck with that of the trunk muscles and perineum. We can also add warm-up in the lying position or in inverted asanas, with our head leaned down towards the floor. It allows coordination of the neck muscles performance in different modes with the work of the trunk. Correct performance of yoga practice obviously needs in-depth review of the other body segment separation and their coordination with the neck. This may be the subject of our next meetings. Enjoy your practice!